Hello everyone. I am myself Dr. Rajesh Gubba. I am the General Medicine Educator on Unacademy. So I welcome you all to this particular clinical sign of the day. So before starting the session, these are some of the updates from Unacademy. Unacademy has come up with these important batch courses. One is Mission INI-CET 2021 batch, and then Clinical Examination and Procedures batch. These batch courses, they are starting from 22nd of September, and those students who want to get subscribed to these batch courses, you can use my code, that is LIVEMED, wherein you will get an additional 10% discount on your subscription. And another important batch courses are Target Next 2022 batch and Target Next Integrated batch 2023. So these batch courses are also starting from 22nd of September, and to get subscribed to these batch courses, you can use my code LIVEMED, wherein you will get an additional 10% discount on your subscriptions. So having said this, let me discuss the clinical sign of the day for today. In which of the following sign is not seen? I'll show you the video first, that is the clinical sign, and then you answer this question. Yes, so you can observe that beautiful sign in the neck of a patient. Right, so the options, they go like this, that is congestive heart failure, or pulmonary embolism, Addison's disease. So first of all, what is that you need to make out? What exactly is that particular sign? So that particular sign is nothing but it is an elevated JVP. So you can observe that beautiful wavy pattern within the jugular vein. So elevated JVP, you will observe that in patients with the congestive heart failure, pulmonary, and as well as pulmonary embolism. But remember, in patients with the Addison's disease, the JVP is reduced, right? They have low JVP. This is a very important point that you have to know. Now, let me just tell you how to measure the JVP. This is a very important examination point in your practicals. So, yes, you require two scales for measuring the JVP. One scale, it is placed over the sternal angle, and the scale which you are placing over the sternal angle, it is exactly 5 centimeters above the right atrium. And another scale, that is the second one, you have to place perpendicular to the first scale. And from where is that you have to start? That is from the top of the jugular position, you have to keep this scale perpendicular to that of the first scale. And whatever the reading you measure, that will be your JVP. But to this again, you have to add 5 centimeters. Why? Because the position of the right atrium is 5 centimeters below your sternal angle. So this will be your measured JVP. So this is a very important examination point that will be asked in your practicals. And let me tell you what are all the conditions where the JVP will be elevated. These are all the conditions, like congestive heart failure, where you have both right and as well as left heart failure. Pulmonary, where you have right ventricular dilatation with or without right ventricular failure, the JVP will be elevated. Pulmonary embolism, right? There will be increased afterload on the right ventricle causing right heart failure, causing elevated JVP. Right ventricular infarction, tricuspid valve disease, particularly tricuspid stenosis and even tricuspid regurgitation as well. Cardiac tamponade, right? There will be non-pulsatile increase in the JVP. Constrictive pericarditis, cardiomyopathies, both hypertrophic and restrictive cardiomyopathies. SVC obstruction, even here also you have non-pulsatile increase in the JVP and iatrogenic fluid overload. So these are all the conditions where you have elevated JVP. Now, what is the homework for the day? Homework for the day is following JVP is seen in which clinical scenario, right? So I have seen you a JVP tracing. So please answer your in the comment section, wherein I'll revert back to you, right? So before ending the session, let me tell you, this is the limited time offer which is going on Unacademy. So interested students can subscribe to these particular courses. Thank you very much.